An interesting research study in the Philippines entitled An Air Quality Risk Evaluation Method for Metro Manila using Spatial Analytic Hierarchy Process, conducted by Maria Lorna N. Ciador and Michael Angelo B. Promentela. Introduction or background of the study. The Philippines had not been an exception to the respiratory-related disease caused by air pollutants and minute particles. According to the Philippine Health Statistics, the primary causes of morbidity and mortality in 2010 were mostly respiratory infections. These diseases were eventually consistent throughout the regions. The Department of Environment and Natural Resources, specifically the Environmental Management Bureau, claims that knowing the air quality levels of an area would promote public awareness and stimulus to the community, organizations, and local government units to resolve the underlying air pollution problems through legislations and policy making. The objectives of this study is to first derive a composite score for health risk index of an area by considering hazard and exposure indices and using Analytic Hierarchy Process or AHP technique coupled with Geographic Information System or GIS. Second, to implement this method in determining the risk levels of cities in Metro Manila. And lastly, to be able to assist in establishing priorities of stakeholders in deciding strategic plans for air pollution mitigation. Materials and methodology. Two analytical tools were used in the proposed model for air quality health risk, and these are Analytical Hierarchy Process or AHP and Geographic Information System or GIS. AHP is a multi-criteria decision analysis tool that enables the decision maker to develop a certain hierarchy of alternatives or factors according to priority or importance. Hazard and exposure indices were the two parameters evaluated using AHP and GIS. Hazard index was estimated using the pollutant loading of sulfur compounds, nitrogen compounds, and particulate matter, and their sources, which consist of mobile, stationary, and area. Exposure index was assessed in terms of population sensitivity, population density, and location sensitivity. Location sensitivity classification utilized GIS on Manila, provided by National Mapping and Research Information Authority or NAMRIA, to acquire spatial data and identify areas for prioritization based on land use such as residential, commercial, industrial, transportation, and other open space areas. Air pollutant data, population and health statistics, and geospatial data were measured to evaluate the risk level of Metro Manila cities. To determine the risk level, hazard and exposure indices was initially calculated using AHP and GIS techniques. Since the risk area in the study is a function of the two parameters, a cross matrix was adopted and the cities were conveniently classified into good, fair, unhealthy, very unhealthy, and emergency levels. Air quality experts from the government were asked to act as stakeholders for weighing the parameters. Finally, the tabulated results were graphically presented with a risk map. As an effective communication tool, the risk map revealed which cities should have further consideration in their air pollution strategies. Cities of Quezon, Pasay, and Pasig had the highest risk level in Metro Manila as their hazard index were high. In terms of location sensitivity classification, land use information were acquired in Manila, which obtained a high exposure index. The area has an increasing location sensitivity as class went higher. Classes 3, 4, and 5 were mainly composed of residential areas and other equally sensitive spots. Policies could target these areas to control air pollution as they could be classified as well as area sources. Using the proposed model, risk level of each cities was quantified through composite score of hazard and exposure indices and classified into a descriptive manner. This provided a reliable representation of air pollution risk. AHP was able to incorporate the subjective preference of the government in the analysis of both hazard and exposure indices, and GIS supported these findings. The model could be a new tool to support the assessments done by the government and help decision makers and policy makers to decide on what regulations to implement or improve.